What was once a problem in rural parts of Canada is now being called a national crisis. A shortage in nurses in larger cities across the country, with hospitals struggling to fill hundreds of vacancies. So they're getting creative in how they're recruiting professionals from other regions, including Toronto. These ads for nursing jobs come with incentives, up to $10,000 in bonuses, rent covered, money towards training, thousands of dollars to relocate.
There's also greater competition between regions for talent, because the reality is, nationally, provincially, regionally, we don't have enough qualified nurses.
Ottawa's Queensway Carleton Hospital launched a regional recruitment campaign in November on behalf of 19 hospitals in the area. 1,000 nursing vacancies were identified.
We need to bring workers into Ottawa.
The national campaign ads, viewed over 18 million times, have made a difference.
Every month, we're bringing in about 25 workers from outside of our region into our region. Who are we targeting? It's everyone from every province. Toronto is definitely a target market for us.
The candidate pool is much larger in the Toronto area. More students are graduating from nursing programs.
I would think that if anybody is interested in rural practice, a place like Fort St. John would be a place to start from.
The Health Authority in northern British Columbia says they've been recruiting nurses from all over Canada, including Toronto. Some traveled out west temporarily.
They'll come and they'll say, all I'm doing is looking after a full ward of COVID patients, and it's nice to come here, and there might be one or two cases in the hospital. And so they're kind of that back to norm.
The pandemic has been putting added pressures on the healthcare system.
The nursing shortage, which exists and has been looming for some time, is only getting worse.
More beds were added to some hospitals. Also, healthcare professionals have been operating vaccine clinics, testing centers. Some nurses left, others retired, and many others feeling burnt out.
What they've been through in the last number of months, they may not stay, and some have left already to go on to other professions and just left healthcare altogether, which really worries me a lot.
But there are some hospitals who are aggressive in their recruitment.
We have been the victim of poaching, if you will, but we haven't taken that step, and we're not going to take that step.
This means there's more competition for Northern Health, who is no stranger to shortages. A selling point for them, getting healthcare workers to recruit too.
Northern Health Authority will pay you $1,500 for doing that.
There are calls for governments across Canada to invest more resources and ensure more students are graduating from nursing programs. The ONA says another challenge is also U.S. hospitals are recruiting more and more nurses here in Ontario and the rest of Canada. In Toronto, I'm Faiza Amin for City News.